Kirsten, hello.
Hello.
Looked at your daughter's images. She has craniosynostosis, as we suspected.
Okay.
Can you tell me a little bit more about the symptoms?
She cries all the time. I consulted 5 or 6 doctors, but no one really helped. They just said I should let her cry, that I shouldn't spoil her. But I was sure something was wrong. She's in a lot of pain.
She has craniosynostosis.
So what are the options?
We need to reduce that intracranial pressure. We can do that with surgery.
Surgery? That sounds really dangerous. My pediatrician said it could be fixed with a helmet.
The helmet won't do any good now. Every surgery has several risks, especially head surgeries. Daughter's otherwise healthy, so that's good.
I'm really concerned. What exactly does the surgery involve?
Two options. We can either go with the minimally invasive procedure or traditional surgery. With the traditional approach, my craniofacial team and I, we make an incision in the head. We adjust the sutures, and then we return them to a normal position. And after that, you really shouldn't see any incision or scars.
This sounds really difficult.
It's big surgery. It can last up to 8 hours. This operation involves the expertise of a number of different specialists working together. Jenny has to be in the hospital for 3 days after that.
If Jenny has this surgery, do we know that she'll be without pain afterwards?
There's no guarantee that the condition will be completely gone after surgery. In some children, there's some residual pain. We can manage it with medication. For some children, we may have to do another surgery, but that's very rare.
Sorry for so many questions. I just want the best choice for my daughter. After all the bad experiences, I want to be sure. So, what about the other procedure, the minimal one?
Minimally invasive procedure, that's done when the baby's less than 6 months old. Takes an hour in the hospital overnight. Can probably go home the next day. She'd have to wear a helmet about 6 months after that. Check it every 3 months.
Okay. Is the helmet painful?
It's not painful. It has to be worn consistently, though. 6 months. If the growth is not normal, we have to do the surgery over again. And that's the bigger one. That's rare, though.
This is all overwhelming. How do I decide what's best for Jenny?
It's a lot to consider.
So you're sure she needs surgery? A helmet alone won't work?
She needs the surgery. If you wait a month, then the minimal procedure won't be an option.
Okay. How can I get more information? Can you suggest other surgeons I could speak to?
You should ask your pediatrician.
This is very stressful.
Think about it. Here's a brochure that has information about craniosynostosis and your options.
Thank you.
Sure.